Ladies and gentlemen, welcome back to On the Mic with Mike, the best business radio program around. I'm your host, Mike King. Appreciate you being here with me. This is part of Mike King Biz Radio Network, which is ESPN Richmond 106.1, the Choice 105.3. That is every day from 2 to 3, as well as International Business Code Radio. But you know what today is? Today is we are here talking to our good friends over at Poplar Springs Hospital. Welcome, ladies.
Thank you. Welcome.
Alrighty. So a lot of times we've had Lamar here, but you know what? They sent the best and the brightest. So who do we? Yes, you said yes, they did. So so who do we have with us today?
All right. Good morning. My name is Dr. Naharia Holt Elliott. I am the clinical director over the military inpatient and outpatient program.
Alrighty.
And I am Misty Nichols. I'm the director of admissions for Poplar Springs Hospital.
Alrighty, Doc. A lot of times, tell us exactly what your role is over at Poplar Springs, and then we're going to talk a little bit about how people are doing and how this interacts with the military as well.
Okay, great. So my predominant role is like supervisor over the military program from a clinical aspect. So my job is to ensure that our clinicians are using evidence-based practice, that we're following the policies and the procedures through JCO and the Virginia State Department of Health, and also to get the patients in and to make sure they're receiving effective treatment.
How is this affecting the GIs compared to the general population?
So if you think about military, when it comes to quarantine, if they're in their home, if they don't have the proper coping skills, they're going to pick up maybe unhealthy behaviors like substance abuse. And that's what we're seeing right now. Majority of our patients are being admitted for alcohol use disorder.
Having spent a lot of years in the military and understanding that's always an issue. Military people always sort of like on the front line, when you're away from home, isolated, and sometimes we don't have the best coping skills. How do I know? Because I've been there doing some of those things that you shouldn't have to do because you are a lot of times young, away from home, and don't have the best coping skills. So what's the treatment process? How do you deal with military folks as opposed to regular? And for the clinicians, is it different dealing with GIs?
It takes a special skill set to deal with active duty veterans, dependents, members. We treat reservists, National Guard, DOD. You definitely have to have a passion for the military to understand the culture. So I wouldn't say it's too much different, but as long as you understand the culture, the treatment is the same.
Alrighty, Misty, we're going to talk about, give us the elevator pitch for Poplar Springs.
All right, so if you are experiencing any type of mental health issues right now, you need someone to talk to, you feel that, you're just not yourself, you can feel free to give us a call at 866-546-2229. We do tele-assessments, so we can talk to you right over the telephone. We can also help you determine what type of criteria you need. If you need inpatient, if you need outpatient, we will be able to provide you with a resource. So again, you can reach us at 866-546-2229.
And you guys also launched what was new and exciting was the evening hours, because as you said, everyone, when you need help, you need help. And everyone can't make it during business hours. So let's talk a little bit about when that is and the services that you provide then.
So we do offer evening IOP Mondays, Tuesdays, and Thursdays on site and virtual. And you can reach us at the same number, 866-546-2229 to be directed to that program. Again, it is evening IOP Mondays, Tuesdays, and Thursday evenings from 5 to 8. You can do both in person and virtual. And you can reach us at 866-546-2229.
Alrighty, so it's on the mic with Mike, a good friends, Poplar Springs Hospital. Would like to thank them for sponsoring the chamber coming back. So it's the newly formed SOFA, that is Chester, that is Colonial Heights and Petersburg, the newly formed chambers. Our good friends over at Poplar Springs sponsored them coming back, because it's always important to find out what's happening with them and what's going on down in the Tri-Cities area. So it's Mike, we're here with the doc. So doctor,
Yes.
How are people doing out there? Always like I asked Misty that, I asked Amar that. How are people doing now as opposed to 18 months ago? The general population, then we're going to talk about military folks.
Well, let me talk about military.
Let's talk about
That's the
GI.
population that I
It's
work with.
always a benefit when they talk to military folks.
Absolutely. So as a military veteran, I will tell you that from 18 months ago to now, I do think that we better have a better understanding of COVID, and we do have a better understanding of coping skills that we can put into place. So in our military program, again, we welcome all active duty veterans, reservists, National Guard, DOD independents over the age of 18 that's struggling with post-traumatic stress disorder or alcohol use disorder, any symptoms that has been elevated due to isolation from quarantine, to come do an assessment. Let us see how we can support and help you. But I will say that from 18 months ago, I do think that we have a better grasp on being able to cope within our service members.
How do I know as a family member, a friend, that my family member needs help?
So you want to look at behavior. So you want to look at any significant changes. You want to see if we are isolating more, are we avoiding? Alcohol is always a great starter point to see if we're drinking more, if we are isolating from our friends and our family. Those are some great indicators that we need help.
And what are the steps that you guys, what's different from a clinical standpoint than it was a year or two ago? Has anything changed really?
As far as COVID or
as far as
treatment?
COVID and treatment?
So I think treatment has gotten better, understanding the symptoms of COVID, knowing that you really don't need to be in quarantine for so many days. But if you have an active COVID test, within 5 to 7 days, your symptoms may dissipate. So if you're asymptomatic, we will take you, and then we will still provide the best effective treatment that we can.
Because I know Poplar Springs is really big on safety as far as
Yes.
COVID goes. Can we touch a little bit on that?
From a military or just a hospital?
From the hospital-wide standpoint.
So from a hospital-wide standpoint, we do understand the nature of COVID. We understand that it's very fast-paced transmission, and we understand the long-term effects of COVID as well, as from a testing standpoint. So we do not actively take from a hospital perspective, COVID positive patients. However, we understand that if you have been positive, tested positive for COVID before, there are long-term effects of the testing measures. So we actually have parameters such as working with hospitals and working with our physicians to actually research symptomology onset, testing onset, or initiation to determine if that is something that we can manage. So we do have different measures of working with the population who have been COVID positive. When at the time of admission or at the time of referral or even coming in as a walk-in, we do take COVID tests for walk-in just so we can ensure safety. From a referral standpoint, we do require rapid testing or PCR tests, and we do look at those results within a certain time frame to making sure that we keep the hospital safe. So we are very diligent about how we set precautions in place for COVID.
One of the great parts about you is regardless of how people need to get to you, can find and meet people where they are as far as help. And it's whether it's virtual, it's online, by phone. You're saying no one should be out there who needs help.
Right.
Poplar Springs is there to help you. Let's talk about the ways that people can initiate treatment with you, and then the type of treatments that are available. Some inpatient, some hybrid. Can we touch on that? Let's talk about on the military side.
All right, great. So for military, we have a 28-day post-traumatic stress disorder program. We specialize in combat and sexual trauma, even childhood trauma. We also have a 28-day chemical dependency program. We have a 7-day detox program, and we also have a 7 to 10-day crisis stabilization program. So for us, it's a one shot. We do our own admissions. There are times when patient access does assist, but if you give us a call, we can do a direct admission, meaning that if I get the packet by 9 o'clock, get the treatment team to approve it by 11, we can have you admitted, say by 5 p.m. the same day.
When you talk about the 28-day process, so one is you have a 7-day detox. How does that work? So all of a sudden, I realize I have an issue, and then I contact you, and then all of a sudden we go through the process. Is it someone saying that I need help, or is it me saying I need help? And then the 28 days, is that Not in person, is you're there
So it's
and you
inpatient.
don't leave? Is it like you see on TV, empty your bags out and all that, and we're gonna check you, and then you come in here and
Yeah. So I will tell you, we
see, that's a military
It's a
kind of,
great question.
it's kind of like a military kind of thing. You went to basic training.
Right. It's a
And we
great
knew what
question.
time it was. You were not bringing in, we got the little amnesty box over there.
Right.
Whatever, stuff you don't want, we just put it over there and we ain't asking no questions.
So that's a good question. So we are a lock unit, which means that it's inpatient. When you come into, you release things that are safety concerns. So we do have a contraband list, but we keep them in a safe. We keep them safe for you until you discharge. We want the service members to be comfortable, but we also want them to be safe. So for the 28-day, it is inpatient 24/7. We are a TRICARE certified facility. We also take the VA community packet. So what that's saying is that a provider has identified that you need help. They send us the referral. The treatment team looks at it, which is myself as the clinical director. Dr. Boss, our psychiatrist, is the medical director. Kashina is our director of nursing. And then Dr. Robinson is our clinical care coordinator. As a treatment team, we look to see if it's a good fit for the program. If it's a good fit, then we'll go ahead and start the process to get them in.
Have we gotten over the stigma of this from years ago?
Mental health is still a stigma in the military.
I thought so.
Mhm.
And that's one of the reasons. So from my time in the 80s to the 2000s, it's still an issue that people don't want to come forward and say. I mean, what do you, from a clinical standpoint, how do you think society as a whole is doing?
So as a whole, I think that if you look at from a civilian sector, I think they're more prone to get help. I think that if there's an issue that they're able to call, I think that you have, employers out there that has EPA that makes it affordable and that makes it open for them to go and get help. So from a civilian perspective, I do think that mental health is being looked at more seriously as far as the patient being able to leave and go into a program. For a military, sometimes you have to look at it as personal, especially depending on your rank, how long you've been in the military. If you look at mental health, am I going to get an MEB?
Yeah.
I'd rather retire out. So I always say that at one point we have to hang up the uniform. So at this time, it is important that your mental health is stable, because when you hang up the uniform, your mental health will still remain the same if you don't seek help now.
And a lot of times being in the military, it exacerbates it, being away from home, being in stressful situations. Let's talk about, is there a difference between how you treat, say, a chemical dependency as opposed to PTSD?
Sure. So if you look at for chemical dependency, we look at medication management is really important. We definitely use different evidence-based practice as it relates to what's the underlying issue from the alcohol. So if you look at substance abuse, sometimes it's not just the substance. We're looking at a way to cope. We're going to sleep. If I drink, I know I can just black out for this amount of time and understand it's temporary. For post-traumatic stress disorder, that's a stress disorder. So even though there is medication management, there is a different type of evidence-based practice that we use. As long as you're in a facility or a program that can help you figure out, why am I stressed? Why am I drinking? Why am I smoking? The outcome is the probability that the outcome of you surviving or that you're healing is higher than if you don't seek help.
And that, that's good, because I go to the VA, and a lot of times you really see younger folks are struggling, and it's different than the older folks. Like a lot of folks who are medically retired have the PTSD symptoms, that diagnosis, as opposed to years ago, we may have had it, but they didn't put a name on it. And it wasn't so readily available to get help. One of the great parts about it is you guys are bringing it to the forefront.
Yes.
And it takes some courage to step out and say, hey, I need help. And one of the things the military folks is that, that part of it, we ain't the best.
Yes.
When it comes to that, you just handle it, continue to march.
Exactly.
And then all of a sudden, like you said, you do hang up the uniform.
You do. Eventually,
no matter how many years you do.
Absolutely.
And it's a shock no matter when you do it.
Absolutely.
It's always, you don't understand how the world works. The world doesn't understand how GIs work. It doesn't make a difference whether you're in the Coast Guard, the Air Force, the Army.
Navy.
The system is the same.
Yes.
And all of a sudden you were just a piece in the system. And when you retire and hang it up, the system continues to go on. All right, so it's on the mic with Mike. We're here with our good friends over at Poplar Springs. Misty, once again, let us know how they can find you out there. And you and your team are the ones, when I got an issue, I call you and your folks.
That's right.
And you're gonna answer and you're gonna give me all the information. Like you said, if I'm in dire straits, you are not letting me off the phone.
No. we
You're
will
like,
not.
no, you are not getting off. We're gonna talk it out.
Exactly. We will talk you through it ourselves. We will also do a wellness check with the local police department so that we can ensure that you are safe. We will not just let you off the phone.
And do you find out a lot that when people contact you, most of the time, what are people looking for and what's the process?
Most of the time when people call, they're looking for an immediate fix. They're looking for immediate.
They've hit the end. They know that is it different when family members contact you because so-and-so needs help, as opposed to when I call you and I need help, I really know I need help.
It's absolutely different. A lot of times we get family members that will call for their loved ones and their loved ones are unaware, or their loved ones are not in agreement. In those cases, it's difficult because I understand where the family is coming from, but at the same time, I have to respect the wishes of the individual, especially if there's an adult. If it's a child, it's totally different. If it's their guardian, then they can pursue treatment. If it's an adult, they have to consent for treatment. If they are in a condition or in a state where they're not able to consent for treatment, that's when you have to get the local law enforcement involved.
And you guys get law enforcement, or the family gets the law enforcement involved?
In most situations, it's the family or the community that gets law enforcement involved. If they happen to be at the facility, or if they're in a state of crisis and want the telephone, we can recognize that. We can actually call local law enforcement and have them go to the home and provide a wellness check, as long as we have the address and location.
All righty. Todd, let's go back to this idea. If you're the person you see with the military, how do I access treatment? As opposed back in the, that's when, back in the day, you went to sick call, and I was a medic, so I understand how the sick call routine works. How does this process work for active duty military?
So what they will do is go to their behavioral health provider.
Okay.
And then the behavioral health provider will reach out to me. We will do a referral. We will do the process as far as the treatment team looking at the referral process in regards to the packet that we received, just to make sure, because we're not a medical facility.
Okay.
So I have to make sure that the service member, that we can meet their need from a behavioral health standpoint and not medical. Meaning you have to be able to ambulate to be on our program, because we do PT twice a day, physical training twice.
Oh, really? You guys are doing PT there?
We're very structured.
Oh.
When I tell you,
so it's not like, I got 28 days, I'm chilling.
It's not the Hilton.
Okay.
When I tell you, when you come to Poplar Springs military program, is because you want to work, you want to heal, and then you want to survive whatever you've been going through. So you have PT twice a day, you have activity therapy, you see your psychiatrist, you have psychotherapy groups. We do AA on site. And so we want you to maximize your treatment. We want you to come with a willingness to say, you know what, I have done everything I can do. Now let the professionals help me.
So what happens at the end of 28 days? The military, we're always big about ceremonies, and we're going to give you a certificate.
We do.
So what happens then?
So once you complete the program, you do receive a certificate. You receive a military coin that has all of the services on there. And you also receive a smartwatch that has Poplar Springs, because we know that behavior health, even though that is very important, one area that you can do better in is your physical fitness. So it does your heart monitoring, it does your steps. We want to make sure that you're the best version of yourself when you leave out the facility.
And what's the follow-up? How does the follow-up work?
So with our clinical care coordinator, we ensure that we always have follow-up appointments after, where you're going back to your SARC, where you're going back to your provider, whether you're going back to your psychiatrist. We make sure that you have a follow-up appointment within 7 days, sometimes 24 hours for active duty, to ensure that care is continuing, because it just doesn't stop when you leave the program. You have to continue your treatment.
All right, on the mic with Mike, the best business radio program around. We're here with our good friends over Poplar Springs. All right, Misty, one last time, how can people find you? And so you know what? I was remiss. I always ask you how people doing out there. How the young folks doing?
All right, so to my young folks out there, I think things are continuing to be the same. I have to agree with Dr. E that adolescents too are experiencing or have an increase in substance abuse. And a lot of parents you know, they work, kids are in school. So life is just different right now, but you have to be able to look out for those differences in behaviors. Because a lot of times when you recognize the difference, you may not know what it is. But
Mhm.
when you reach out to someone and say, hey, something is just not going right with Misty, then once you get a professional in place that can start to, they know the right questions to ask, they know how to relate to adolescents when they're talking to them, you'll start to pull back the peels of the banana, and you'll start to find out what's going on. So sometimes it's not always just depression or isolation. Sometimes it's really substance abuse. You know, the world has changed. Marijuana is common these days.
It is common. I mean,
Pills are common.
Lord have mercy, is common everywhere I go. I went into a business and they had hemp, and that's when I realized how old I was, because I'm like, is that legal? You know, I'm looking at it. It sure looks like, you know, Cheech and Chong back in the day. And they're like, okay, but it doesn't do the same thing. It's calming effect and all of that. But, you know, it's like everywhere I go out on the street, it's just, and whether they think it's a gateway drug or whatever, it's not for everyone because it's a slippery slope.
Absolutely.
And as parents, we have to be mindful of, you know, the environments that the way of the world right now, you know. And so it's not always an easy topic to explore with your children, but as a parent, we have to learn to sit down and have those hard conversations sometimes, because that's when we'll learn, you know, what really is going on. So again, you know, you can call us out at Poplar Springs. We can do telehealth assessments. We can get you referred to community services that are available, and you can reach us at 866-546-2229, and my team will be available 24/7.
All right, Misty, thanks for coming, Dr. E. So really this is a personal side note right here. So you just had your son's going to Fort Campbell.
Yes.
Shout out to her. He's a new. So, you know, he's a paratrooper. Shout out to the paratroopers after all what everybody doing. Everybody doing the airborne shuffle.
Yes.
Who's out there? He is a rigger. He makes sure everything is square with the parachute. So good luck to him. It's always great when somebody comes into the paratrooper community. It, you know, only, you know, why do people jump out of perfectly good airplanes? To check out perfectly good parachutes, and they're done by the rigger. So good friends, Poplar Springs, like to thank them for coming on the mic with Mike, the best business radio program around. We're here on ESPN Richmond daily 5 to 7. Thanks, folks. Take care now.
All right. Thank you.